At University of UofL Physicians, we're called to deliver patient-centered care with compassion and excellence. But that can be really hard to do sometimes. We're all distracted by the work environment that we're in, emails, phone calls, long lists of patients to be seen, other distractions if you're not in the clinical setting, that just make it hard to understand how can I deliver that kind of care every time, every day, because every patient deserves our full attention. I can tell you that there's a portrait that helps me to center myself as I enter into the clinical arena and see patients, that helps me push away those distractions and be mindful of the environment that I'm entering. In 1887, there was a portrait painted by a London artist. This artist had lost his son on Christmas Day 10 years before and was thought to be the inspiration for this portrait. The portrait's titled The Doctor, and as you can see in this portrait, it shows a scene in a small cottage in the late 1800s where there's a doctor, a young child that's sick, and parents in the background. But look at the focal point. Look where the light is. The light is on the space between the doctor and that child. That space, I think, is sacred space, akin to the priest at the altar, the rabbi in the temple, and whether the doctor is at a bedside like this, or in a modern setting, at an operating room table, in a hospital, in a clinic, that space is the same now as it was 130 years ago, as it was 2,000 years ago. That space is sacred. And our work that we do at UofL Physicians, whether you're a clinician inside that space or a person supporting that role, is vitally important. The work that we do, the real work that happens even now, I can recall a situation just a few months ago where I was asked to see a child in the intensive care unit who had Rocky Mountain spotted fever, a potentially life-threatening illness in a 3-year-old girl. Not unlike this girl in this picture. And the setting that I was in, although in an intensive care unit with monitors and ventilators and tubes and wires, far different than this, I assure you, was the same kind of space that this doctor was in. And I picture this portrait as I enter rooms like that, because it helps me to push away the distractions. It helps me to focus on the importance of that role that I have right there to that baby, to that family. And in that room, I assure you, it looked just like this in terms of a family in the background that was in anguish about whether their child would even survive this infection. For those of you who are not in the clinical space, but you work in accounting or finance or in IT or in HR, know that without you doing your job, the work in this space couldn't happen. Your job is incredibly important. You make a difference. You make it possible for this space to exist, to work, to capture all of the infrastructure that the physician or the nurse practitioner or the nurse needs to be able to make this space work, to deliver what this portrait shows so clearly, the patient-centered care that our mission statement calls for. At UofL Physicians, we're called to deliver patient-centered care with compassion and excellence. You too should remember this portrait as you do your daily work. Everything you do makes a difference.